Hi, hello everybody. My name is Dr. Lindsay Ogle, and I'm a board certified family medicine and obesity medicine physician. And I started a telehealth company called Missouri Metabolic Health, and I help patients treat and prevent metabolic conditions through lifestyle management, weight optimization, and utilizing safe and effective medications. And with starting this company, I have reached out to a lot of wonderful health professionals across the state of Missouri to connect with them. And I decided to ask some of them to join me in this virtual health summit so they can share their expertise with a wider audience. And I am so excited to have Ra here today. And she's an amazing guest, and we're going to be talking about stress management. So I'm going to have her introduce herself and share a little bit more about her experience and how she helps people.
Yeah, thank you, Lindsay. My name is Ross Saw. I'm a licensed clinical social worker, and I own a private practice. I'm the only therapist, though, of that practice in Springfield, Missouri. And I have been a social worker since 2011, and I graduated from the University of Arkansas in Fayetteville, and just have been on that career path ever since. Yeah, so I'm happy to join you today and with the others that are able to join us or maybe see this later and kind of talk about stress management.
Wonderful. Yeah, this is such an important topic. I know a lot of us really struggle with stress in day to day, and I would just like to start off with kind of the definition of stress. How would you define stress as a therapist?
So I think that stress is kind of like complex in a way, even though it's such a common thing. It can affect you physically, mentally, and emotionally. And it's actually a person's like response or reaction to things outside of themselves or the demands that they may be feeling. It can happen when they perceive a situation or a person as challenging, overwhelming, or threatening. In what happens is it'll activate the flight or fight response, which actually then releases chemicals, stress hormones that are cortisol and adrenaline. So that will in turn cause physical reactions that some people might report, such as some people report like muscle tension, headaches. They might feel shaky, jittery, things like that.
Yeah, great. And a lot of my patients or friends and family, when they talk about stress, they kind of just feel like that overwhelming sensation in their body. And some people experience it on a pretty regular basis. Do you have any tips on how to kind of identify the source of someone's stress, especially when it feels so overwhelming?
Yeah, actually, I get this question asked a lot by my clients that I work with because stress is so common. And, we live such busy lives nowadays that we're just go, go, go. And we rarely do take the time to actually like slow down and think about how things in our lives might be affecting us emotionally and physically. So I usually recommend people to just kind of like self reflect a little bit, to take the moment to like either with myself or by themselves to think about what aspects of their lives do they find that the stress is the highest. For a lot of people, it's usually work. The work might be very demanding, or I've actually had people who didn't have demanding work or their supervisors were not demanding anything, but they put that pressure on themselves due to like maybe perfectionism or just having really high standards. And, in turn, they would overwork. Or it could be family conflict. We all have family, right? We love them, but sometimes we don't all have family that get along. So if you are constantly arguing, having tension, things like that in your relationships, or even with your spouse or partner or whoever you're dating, and even friendships, that's really important because social connection is such a big part of our well-being. So there's different things I tell people to look at. And then the main one, of course, which kind of makes sense with the summit, is health. If you're suffering from a chronic illness or disease, that can definitely increase your stress levels.
Yeah, yeah. Thank you for going over all of that. And I can
Yeah.
imagine that it can be really helpful to sit down with somebody like a therapist and kind of go through those different topics and tease it out. And I'm assuming with a lot of people, it can be several different sources of stress. Do you tend to kind of help your clients prioritize where you're going to focus, or can some of the treatments help with several different sources at once?
Yeah, I try to personalize it for everyone since everyone's so different. I would love to have just like a kind of like a schedule of things that I would do and go over and that work for everyone. But I found that that's not the case. I really have to listen to them and see what is the main issue, what is the main cause and source of stress, and help them prioritize. What can we take action on now? What can we kind of problem solve together to make it better? Because if we continue to do the things the way we've always done them, we can't expect any changes. But the little bit of changes that we do implement over time will make a huge impact. Yeah.
Yeah, great, great. And that seems to be a theme that is coming up with everyone that I'm talking to at this summit is that there really isn't like one regimented, like
Right.
easy answer. Really, everything needs to be individualized, and again, highlights the importance of finding a qualified health professional to work with. Because I think sometimes we see on social media that somebody is saying, just do this one thing and it'll solve all of your problems. And unfortunately, that's often not the case.
I really wish it was so easy, if only.
Yes, yes, if only.
Yeah.
Is stress ever beneficial for someone?
Surprisingly, my answer would be yes,
Mhm.
because people don't think about it, but we do have good stress. Some examples of good stress would be getting a new job that you're excited about, going on a vacation, going on a first date, getting married, planning for that wedding. Taking on a new hobby or new interest, meeting new people. Those are all good stresses. And then, of course, bad stress would be the work stress that I talked about earlier, being in a toxic work environment, working a lot of overtime, financial issues. If you're having trouble paying your bills, I mean, that's going to put a lot of stress on you. Chronic illnesses that you feel like are not improving or being manageable, relationship issues, arguing constantly with people in your life, or feeling like you have to walk on eggshells. And then major life changes like divorce, loss of a loved one, or unemployment.
And if you're having too much of that bad stress, how might
Yeah.
that affect your health?
Yeah, well, that's where they're finding there's been a lot of research done, and I think they're continuing to study it because they're finding that it has such a huge impact, more than people realize. It can cause physical issues like high blood pressure, headaches, migraines. It could cause your immune system to be compromised and more suppressed. It can cause GI issues. I know a lot of people who suffer from chronic stress that have IBS, muscle tension, sleep and insomnia or excessive sleeping. Some people, that's all they do after they're done for the day. They just sleep, but they don't have time for anything else because of that. It can cause behavioral issues because if you're trying to cope on your own and don't really have the information to know how to cope in a healthy way, a lot of people will resort to overeating or smoking, drinking alcohol, or using other substances, whether legal or illegal. And then withdrawing from other people. A lot of people tend to isolate when they don't feel well, which kind of causes a vicious cycle, I believe. It does provide some immediate relief, even if it's unhealthy, but in the long term, it does not help with the stress.
Yeah, so what I'm hearing is it can affect almost every part of us in our well-being. So very
Yeah.
important to take note of. And
Yeah.
how would somebody, if they're feeling like maybe they're having too much stress in their day-to-day lives, when should somebody seek for professional help?
Yeah. So I always recommend, I have friends and family ask this all the time and just people I know. And, if if your symptoms like, and I forgot to mention earlier, like it can also cause irritability, mood swings, and anxiety and depression. Um, so if you're having physical, mental, emotional, and behavioral issues because of the stress and it's lasting for a long period of time, which for me, I feel like if it doesn't resolve after about a month or so, then you should probably consider seeking some outside help from a professional. It just helps to hear someone from an objective point of view with some training to help you figure out, hey, what can we do to tackle this for you?
Yeah, yeah. I think that's a really good guideline. Um,
Yeah.
and do you have any tips for somebody maybe to help manage their stress? Maybe if they're working in that month when they're trying to decide, do I need to talk to somebody about this, or
Mhm.
if maybe they can't get an appointment for a certain amount of time, what sorts of
Yeah.
things can they do right away to help lower their stress levels?
Yeah. I always tell people try to, even if it's only 5 minutes a day, starting with that, of course, increase over time, relaxation techniques. And it could be as basic as deep breathing. I know a lot of people take that for granted, but research shows that we do not breathe properly after a certain period of time, and we just naturally learn to breathe very shallow. So even if you spend 5 minutes, maybe you're stuck in traffic at a red light, you can deep breathe that time, and it would help you. I will also tell people to get plenty of sleep. If you don't get enough sleep, it can be equivalent as to uh, being like intoxicated because you're so tired. You can't concentrate, you'll have memory issues. It'll just increase your anxiety and stress level. The other thing is to exercise. I know that's easier said than done for a lot of people, but I always tell people to break it up into smaller increments, like 10, 15 minutes, even if it's just walking around your neighborhood. It doesn't have to be like to go to a gym and join a gym and get a membership and join a class and commit to 3 times a week. No, we don't want you to start like a marathon. Like we want you to prep first, prepare yourself. And then the other thing is, of course, what you eat does make a difference. I know it's really convenient to just grab something on the go or go through the drive-through, but what we eat does really truly affect not us just physically, but mentally. You will gain more clarity and the ability to actually problem solve your issues if you are on a healthier diet. And I'm not saying you have to eat a salad all the time, but finding that balance, I think, and making sure that you're getting all the essential nutrients and vitamins that really make us function very optimally. Um, and then for a lot of people, this is a common theme that comes up in my practice is boundaries. When we don't set boundaries with other people and ourselves, whether that be overworking or not letting people kind of like walk all over us, um, it will cause more stress. So naturally, when we start setting those boundaries, even though that it's difficult, it can help manage it.
Yeah, absolutely. Thank you for
Yeah.
going over all of that. And what I find so interesting is that those are, a lot of the same recommendations that we make for other health changes. And so if you're implementing even just one of those things, you're going to help yourself in many facets of your life and of your health. And so we don't have to, just focus on one thing that you're improving. You're going to be improving, your stress levels, you're going to be improving your metabolic health, you're going to be more functional in your day to day,
Yeah.
you're going to have better energy levels, blood pressure lower, all of those things is going to be helped with implementing those suggestions. So that's all wonderful. And I'm curious what your thoughts are because, we do hear those recommendations all of the time. So it's one of those things like we know what we're supposed to do, but we don't always do it.
Mhm.
Can you maybe speak a little bit on that and also how working with a therapist or a coach or somebody else can help really create some of those habits that will be more impactful and stick longer term?
Yeah, I try to. find, of course, we experiment when I first meet someone of what they might like to try. And usually if the client is on board with an idea, they're more likely to succeed. It usually, you know, gets that one foot in the door, and then the last step is to get the other foot. The other thing is to I tell people to schedule an actual time to do it
Mhm.
and be very consistent, but don't be discouraged if you miss that time. Just start over the next day. It's okay. They're not being graded. There's no exam,
Yeah.
and they're not going to be in trouble with me.
Mhm.
but but I find for most people, when they actually schedule or designate a time to do these activities, they will do it. They're more likely to do it at least majority of the time, like in a week. So
Mhm.
that seems to be the best. And they know their schedule, they know their, limitations, what works best. So just figuring out what works for you. And if it doesn't work, try plan B. And then I even say go all the way down the alphabet. Plan B, C, D, E, F. Just being flexible. And then trying to figure out what is the motivation behind wanting to make changes. If they're already seeing a professional about this, then they're already motivated. They wouldn't have gone through all that trouble to find someone and actually meet them and make that appointment if they didn't truly want to make changes, you know. So kind of like helping them see that, giving them some insight on, you came here for a reason. So
Mhm.
there must be a purpose to this.
Right.
Um, why is that? Just trying to like self-reflect more.
Yeah, great. I love that. Well, thank you so much. And I think we will have time to do an exercise. I know we talked about
Yeah.
practicing a stress
Uh-huh.
relieving exercise. But before we do that, do you have any other last minute thoughts or anything else that you would like to share?
I always like to tell people about the nationwide 988 number. It's a crisis line. You can call, text, or chat to speak to a trained professional if you ever feel like you just need someone to talk to. Could be 2 a.m. in the morning, 5 a.m. They'll be there. I always tell people don't hesitate to use that resource because it's there for us.
Mhm. Yeah, thank you so much for bringing that up. It's a great resource. Definitely recommend as well.
Yeah, and the fact that you can text too.
Yeah. Oh my
That's
God.
a new update.
Yeah, that's amazing. It makes it even more convenient and less intimidating to ask for help that way.
Mhm. Yeah, definitely. But yeah, I am an EMDR therapist. So this technique is actually an EMDR resource technique, which is to help people center, ground, and get calm. It's called Calm Safe Place. And I usually tell people to visualize or try to think of a place. It could be real or imaginary that the moment that they think about it helps them feel calm or safe. And so for me, that would be the beach. Do you have a calm, safe place, Lindsay?
Yeah, I did my residency in Colorado, and there was this one particular hike that I just loved, and it overlooked a lake, so it includes water as well. I think water is
Yeah.
calming for a lot of people, but yeah, that would be
Yeah.
my place.
Okay. So I usually tell people if they need to close their eyes, it helps them to visualize it. You don't have to, you can leave them open. And to visualize this place and think of all the five senses that are related to it. And that could be, what do you see? What do you hear? What do you feel? What can you touch? And can you taste anything? Is the last one. And if you can't taste anything, maybe focus on what feelings does it bring on. And so I tell people to focus on this image and all the five senses and how it makes them feel, and then just to focus on that. And then usually for EMDR, I use they're called buzzers. They're bilateral stimulation devices you hold in your hands, or there's headphones you can put on, or when you're doing it at home, because they don't usually have these devices, The other option would be to do butterfly hugs, where you would lock your thumbs like this and place it on your chest and just alternate tapping
Mm.
and do it slow and steady. And I would do about 6 to 8 sets and no more than that, because usually if you do more than that and do it too rapidly, it could reprocess maybe traumatic memories or negative things. The focus of this exercise is to remain on positive thinking related to the calm, safe place.
Wow. Well, that is so helpful. Thank you for going over the exercise. I'm
Yeah.
sure a lot of people are going to try that and get a lot of benefit from it. So I appreciate you sharing.
Yeah, my pleasure. And I tell people it may feel awkward at first, and that's okay. That's expected. No one feels like they know what they're doing at first, but it takes practice. But it really does help you ground and feel relaxed, even if it's for 5 minutes.
Yeah. Yeah. I think most of us will take 5 minutes of relaxation for sure.
Yeah,
All
definitely.
right. Well, thank you so much. I'm sure people are going to want to get a hold of you, follow you, maybe even work with you. If anyone wanted to learn more, how would they get in touch with you?
I have a website. It's called Radiant Therapy LLC.com. And I can also be found on Facebook or Instagram.
Okay, great. And I'll include those links below. Thank you so much. And I look forward to future collaborations.
All right. Thank you.